Hi everyone, this is the Para Podcast. This is where we look at an interesting research paper that we found and we thought we must share it with you. This is not us suggesting anything, but we just read the paper, what it says to you. And if you like it, you can incorporate it to your practice. Or if you think that your research department has never seen this, I suggest that you send it to them and see what they think. So today, the paper that we're doing is titled Pediatric Weight Estimation Practices of Advanced Life Support Providers in Johannesburg, South Africa. The paper is by Professor Mike Wells and Loris Barnes and Professor Craig Lambert. I think Professor Lambert is from UJ, and then Mike Wells is from Florida Atlantic University, and Loris is Cornerstone Institute. That is where they're from, or their affiliations. Anyway, what inspired this paper is some time ago, I was going to a case whereby there was a pediatric patient. I think there was an estimation of age, it was 18 months. Now I went to my app and then I tried to look for 18 months. I couldn't find the weight because it is said if they're 2 years, this is where you click and then you get the weight that is estimated there. Now, I wanted to know what's the accurate, what is behind this? How accurate are these estimations? Anyway, I think the significance of this study is that once you get the weight, it then determines what type of medication, not the type, but the quantity of medication that is going to be administered to the patient. That matters because sometimes you might underdose the patient or overdose the patient. Now, this paper discusses that. That is what it is about. Anyway, let's get to it. I'm just going to highlight areas that I found interesting and just move along. In the first paragraph, it says, age-based formulas together with healthcare provider guesses of weights have been found to be amongst the least accurate in all estimation systems. However, the Brozo tape has also been shown to lack sufficient accuracy, both in high-income and low and middle-income countries, so globally. And then most accurate systems described are two-dimension system whereby you measure the length of the baby or of a pediatric patient and the body habitus of the patient, which means the morphology of the body, how they appear. So you measure those two systems, then those systems are much better. And they gave an estimation or a suggestion that there is a Messi method and the PAWPER tape. Not sure if you've heard of those systems. Right. Now, this paper was done using a qualitative method. It is a paper that had ethical approval. The research was, they had the ethical approval from University of Johannesburg. They had 40 participants. They estimated that there was about 80 to 100 practicing paramedics, advanced life support paramedics in Johannesburg at the time. They then suggest or state that there was at least 29 over 40, which was 72%, had more than 2 years of experience post-qualification or graduation, which means they had moderate experience. Now, these paramedics were asked questions. There is a question, research questions that are provided in the paper, which doesn't happen most of the time, but you have it there. So they were given a couple of methods. There's 11 questions. I'm not going to read all of them. Others were from the private sector. Others were from the government sector. Right. So check it out. You'll see the questionnaire, and then you might see how were you going to answer yourself. But the options that they were given was There's the Brosler tape. Which system? The question was, what weight estimation tool do you currently have at your disposal in your work environment? And the question was, and the answers were the Brosler tape, the PAWPER tape, Messi method, age-based formulas, parental estimation, visual estimation, none of the above, and other methods. I bet if the paper is done now, there will be an app that is developed by a service where they work if they have such. Right. So in terms of the responses that they had, on the visual estimation, about 20% were familiar with that method. And participants who said that method was available to them, everyone, 100%. And then the participants that said they preferred that method were 18%. They said it is a quickly method to use. Normally, the parents do not know their children's current weight, and it is what is available. I'm not going to mention all the results. You can read them for yourself. But then we'll go to parental estimation. Right. So parental estimation, about 28% of the participants said they are aware of that method, and everyone had that to their access. And 8% said they used that method, and it was a method they preferred. And their reasoning was parents should be the most accurate to estimate the weight, and parents generally know the weights of their children. That is what they said. And then we have the PAWPER tape. About 68% said that they were familiar with the method. And then participants who said they had this method at their disposal were 22%. And then participants that said they preferred this method was 28%. And it seems that those that used this tape had more comments than most. Right, so they said it was easy to use, prevents confusion, and I was bad at math, and so on. You can check those yourself. And the last one that I'm going to read for you, please go and read the paper and see what are other methods that were highlighted there. The age-based formulas. 93% said they used that one. And then 40 of them, 100%, said that they had that at their disposal. And then participants that preferred this method was 40%, 16 of them. They believed that it was most accurate. They believed that it was suitable for emergency situations. They believe that it's the fastest, and it's actually the closest that you can get the patient weight. Those are the results of this paper. Now, in the discussion, the authors of this paper actually say very interesting points that I'd like to bring to our attention. Very robust, the way that they write. And I find it very interesting. Right, according to our research on Medline and Scopus, this is the first published study to have described which pediatric weight estimation systems are actually used in the clinical practice, in particular in the pre-hospital environment or anywhere in the world. And then there's a paragraph that says, there are three major findings in this study. The level of participants' knowledge about the survey weight estimation method was poor. Secondly, the preferred method of weight estimation used by many participants were methods known to be inaccurate and inappropriate for emergency care. Thirdly, not all ALS paramedics had access to the most accurate methods of weight estimation. And then there's another paragraph that says, while the PAWPER tape is taught, advocated, and made available for pediatric weight estimation in some public and private sector institutions and services, most ambulance training colleges and services still teach to use the age-based formula. This has resulted in delayed adoption of the newer, more accurate method. They mentioned that the Messi method is not currently taught by any institution. So it seems like there is a lot of change that has to happen based on this paper. The paper suggests that whatever that we're taught is likely to be inaccurate. Therefore, we need to try and convert to the PAWPER method or the Messi method. All right, I'm going to go to another paragraph that I found interesting too. Weight estimation formulas are not only inaccurate in estimating weight, but calculations required may add to already elevated levels of stress experienced by the user. The ability to remember the formulas may be impaired in emergencies, further aggravating stress levels and increase the risk of errors. Yeah, there are only two studies in accuracy of parental estimates of weight in low and middle income countries, both in urban areas, which show parental estimates to be reasonably accurate. Parental estimate would therefore probably be a valid method to use in urban areas, would certainly be preferred to use for visual estimation or age formulas. I wonder though, in rural areas where people really don't care about the weight, they just enjoy that their baby is growing or their children are growing, do they actually know about the weight? Some other families don't even have scales for their pediatric patients, really. But yeah, I think it's something that we need to consider and think about. The best choices for accurate weight estimation would have been the Messi method and the PAWPER tape, with the PAWPER tape more suited in the pre-hospital environment. The Messi method was not familiar to any participants. So there was no one who was really familiar with the Messi method, although it has low-cost method, which has been proven to be accurate. Right. And then it's also possible that emergency care practitioners are not exposed to weight estimation methods such as the PAWPER tape and Messi method in emergency centers to which they transport the patients to. This is the potential intervention point for education and upskilling paramedics. The PAWPER tape, Dr. M. Wells developed it from Wits University in Johannesburg. So it really considers patients of diverse backgrounds, and it has been thoroughly assessed. And as compared to others that might have not had the privilege of being assessed from or evaluated from diverse backgrounds. Now, the paragraph that I found interesting towards the end now, a recent study evaluated the weight estimation accuracy of the PAWPER tape in simulated pediatric emergencies with the children in realistic clinicians. For example, in a spinal immobilization with various degrees of cooperation, so the children were cooperating. And also there was a study that was done where there was a child with the convulsions, showed no difference in accuracy between the formula. So basically, it's a long tape that you use. You put on the heel and the head, and then you measure. Now, I'm trying to visualize during a convulsion. How do you do that? It might be hard, I think. The current knowledge and the use of pediatric weight estimation required by advanced life support practitioners in Johannesburg was not at an appropriate standard. Now that one is a kick, that one there. It means that people didn't know what they were doing really, based on the study. That's what it says. We recommend that more emphasis is placed on the use of the PAWPER tape and the MESI method in emergency medical care training institutions and emergency medical service providers, organizations, and also the access to this method be improved. Which method do you use in your organization? Do you have confidence in that method? And then also, I would like to tell you something. We are likely to have Professor Mike Wells coming to the Para podcast. He has confirmed his availability. We are going to discuss this PAWPER tape, and would like to. I think he's one of the developers of this tool. And if you have any questions about it, please write it in the comments so that we ask him. Possibly in about a month's time, we'll have him in the interview, and then possibly in about 2 months' time, that's when you'll get to see it. Please follow our YouTube page too. We'll highly appreciate that. You follow and then you subscribe. Thank you very much for the TikTok family for following us and sharing our videos. We highly appreciate it. Thank you very much. We'll see you on the next one. Roger.